I'm just going through the first response kit. In this front pocket we've got the BP cuffs, we've got blood glucose kit, a tympanic thermometer, pupil torch, clothing shears, stethoscope, and yeah, in this one we've just got miscellaneous items. In the side we've got some 2 tourniquets, we've got crepe bandages, triangular bandages, combine dressing, saline, we've got some gauzes and some steri strips. In these two here we've got the glucagon, we've got IV glucose and also the oral glucose, a giving set and a syringe. This one here we've got the emesis bag, we've got the ethyl chloride spray, a set of glasses and a lanyard. In this black part here we've got the methyl oxyfluorine. In this little pouch we've got some Panadol, ibuprofen, tramadol, some loratadine and some nausea tablets. I want to check the expiry date and how many's left in there as well. In this middle section we've got the laryngoscope and the blades. We've also got some OPAs, MPAs, a yellow hazard bag, the medral forceps and some lube as well. In this last one we've got more drugs here, so we've got the salbutamol, ibuprofen and the adrenaline. In this other side we've got the nebulizer mask, which is adult and child, and also some oxygen tubing and the nasal prongs. With those medications as well, we'll check the date and how much is left there as well. In this big pouch we've got the miscellaneous items, so a towel, we've got the sharps container, some slippery Sams, a couple giving sets and some saline, also the neck brace and some splints. In these two bags here we've got the child and adult bag valve mask, also some oxygen tubing, we've got the PEEP valve, the reservoir masks and also just the normal giving mask as well. In this next pocket here we've got the LMAs, we've got a syringe, we've got the 2 sizing of adult Thomas tube holders, the adult and child. We've also got the Cobbs connector in here and some lube as well. And then this here is just the IV roll. It's got some syringes, some needles, some giving sets, all used for the IV. So we're just going to demonstrate how to use a LifePak 15. So first off you would check the battery, so it's just at the back here and you press these buttons, and as I can see this one here is going flat, so we would just take it out and grab a new one and then just pop the new one in there. And next we would just check on this side, we've got the cable, so you've got the 3-lead cable here, you've got the SpO2 cables there. We also have some aspirin in here, some GTN and also a razor. On this side we've got the defibrillator cords and we've also got the Tesla here, which we'll use soon. We've got the defib cords that actually attach to the pads, which we unfortunately don't have, so we need to get more of those, and the 12-lead there. Also in this back pocket we've got the 2 blood pressure cuffs, so we've got adult and the child size. And also we just need to check the paper, so this one looks like there's enough there, and there would also be some spare at the back. So to turn it on we would just press it here and it should start up. Yep, and we would just put it into manual mode by pressing energy select and then selecting manual mode. Yep, and yep, so it should do that. We'll do a user test first to check that it's okay to use, so go options and then down to user test, and it should work. And while that's doing that we'll attach the leads. So we've got the right arm here, which will just pop there. We've got the right lower, which will pop that side, the left lower there, and the left arm just up there. Yeah, and so we'll see that it's printed off this one here, so the user test has passed, so it's okay to use. Next we will do a test shock, so we'll press charge and it should charge up. And then just when it's charged fully, you press the shock button and it will advise the shock. And see, energy delivered, so it's all good. And next we'll dump a shock, so same thing, charge it up. You just press the speed dial here, which cancels the shock there. If you want to change what leads you see, the lead option, you just press this lead button here and it shows you the different options, and you just scroll down what you want to see. Also, the sizing of the wave, you can change it there. It can be bigger, it can be smaller, depending on what you like. We can also do volume, so we'll just go options and then volume there, and then you can change it lower, higher, that kind of thing. And then next we can change it in and out of the manual mode. So manual, like I said, energy select, you select manual. To change it out of manual, you press CPR or analyze, and then it will put it in the AED.
Analyzing now. Stand clear. No shock advised. Start CPR.
And that's everything. Hi, so we're just gonna demonstrate the suction. So usually before a shift, you'll just check the suction, you'll do a test, and we just want to make sure that all the tubing's in here. So this one seems to be fine. And just to test it, we'll hold down this part here, just block it off. We'll turn it all the way up and then hold the test button, and it should just rise right to the top. And once it hits that top button right there, it should automatically turn off. And we'll just double check that it is working. So we'll turn it back on and we'll just, yep, it seems to be working. Also, there are two different types of catheters. There's the rigid one like this one, it's quite firm, and then there's a soft catheter, which is for in the ambulance when you're on rocky roads, that sort of thing. On a patient, firstly we'll grab our gear, so we've got gloves, and we'll put our glasses on, and we'll turn our patient into the recovery position. So just like so. And then we'll turn the suction on. Also, to stop the suction, keep your hand off the circle or the hole, and then put your hand on it. We don't want to suction while we're going in. We just want to suction on the way out. So go in, no suction. Just make sure you're suctioning where you can see it in the mouth. So no suction, and then on the way out, just little circles and get what else is in there. Yep, and make sure not to stay in there for more than 10 seconds. The complications that come with suctioning is there's induced vomiting, soft tissue trauma, bradycardia, and hypoxia, aspiration, and laryngospasms. So yeah, just making sure you're not keeping it in there for 10 seconds, because those complications can occur. So today we're going to be talking about the oxygen bottle that we use on the ambulance and how to administer it to a patient. Firstly, it would usually have just a sign here that says it's oxygen. It'll also say full, in use, or empty, depending on how much gas is in there. We also have the regulator here, which just make sure you check the Botox seal, because if it's damaged, it won't work as well. So this one looks fine, there's no damaging there. We've got the dial here that says how much oxygen is in the bottles. And we've also got this dial on the side, which allows you to choose how much oxygen you give. And just to put it on, we just put it here on the side and then twist it, and it should just lock in. And there you go. And then just turn it on a little bit, and it should just show how much oxygen is in there. And so this one's quite empty. There's actually not much here in it at all. In terms of mask, if we want to give a small amount of oxygen, maybe 4 to 5 liters per minute, we would use a nasal prong. So this just goes in the nose here, up the ears, and then you just use this knob here to adjust. In terms of maybe a resus, you would use quite a large one. So this gives 10 to 15 liters of oxygen per minute, and you would just put this on here. You would, just put that on there and then adjust it to 15 and make sure it's on. And then just, when you're using it, to make sure that it's lying down on the ground so it's not a hazard to anyone surrounding. And then just put the mask on, make sure it's nice and tight, and then give your oxygen. In terms of shutting it down, we'll just take this off and then turn the oxygen to 0. There we go. And then you would bleed it out. So turn it off first and then turn it back on, and then all the air, if this one was more full, more air would be hurt out, but it would bleed out and you would know it was off. And again, for safety precautions, always have it lying down and the regulator off if it wants to come off, and then just lying down. called out to a patient who's just collapsed and she's apparently unresponsive. We've arrived at the scene and there's no dangers. The exit and entry seems nice and clear. There's no bystanders or anything like that. The ambulance is parked close by if we need a quick exit. Kate, are you okay to go?
Yeah.
Okay. Hi, sir. Can you hear me? Hi, sir. Okay, I'm just going to inflict some pain. Hello? Okay, he's not responsive. I'm just going to check his airways. Okay, his airways are clear. He's got a GCS of 3. I'm just going to check his breathing. Okay, he doesn't seem to be breathing. Kate, could you start compressions?
Yeah.
I'm just calling for backup AUT to comms. I need a R50. Okay, I'm just going to get the defib attached to him.
21, 22, 23, 24, 25, 26, 27, 28.
The defib is attached. I'm just turning it on.
Analyzing heart rhythm. Do not touch the patient.
Just clear out. I'm just going to attach the BVM to the oxygen bottle and turn it up
Shock
to 10.
advised. Charging. Stay clear of patient. Deliver shock
Okay, everyone
now.
clear?
Presley shock delivered.
Yep, and start compression.
Pause. Start CPR.
I'm just going to insert a OPA here, so this is the right size. And the complications with the OPA is that if it's the wrong size, it can cause induced vomiting and also soft tissue trauma. And it also can lock the jaw, and we can get a locked jaw. Now I'm just inserting an MPA. It's the right size.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2. And the complications with the MPA is if it's the wrong size and there's head trauma, it can cause more damage. And also if there's polyps, it won't go in quite as nicely. Good compressions, Kate.
23, 24, 25, 26, 27, 28, 29, 30.
Okay, I'm just ventilating with the BVM. And the complications with the BVM is if you compress too hard, it can cause increased thoracic pressure, it can cause gastric inflation and also damage the alveoli.
24, 25, 26, 27, 28, 29, 30.
And we'll just swap over in the next analyzation case so you can get a break.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Just going to make sure that it's a nice lock on the face so it does good pressures, chest rises, sorry.
30.
Good job. 2.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Twenty-one, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're just doing CPR so we can get better perfusion to the brain. Kate, could you count my compressions? And we just want to make sure we're doing 100 compressions per minute. And we also don't want to push more than 1/3 of the way. At this point, I'll be asking any bystanders what happened, if they know the patient, if their family, if there's any history of heart attacks or heart failure, if they're on any medication, sorry. And that way we can get a better understanding of what has happened to the patient and how we can treat them.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause.
And there, if he's
If
okay,
needed, start CPR.
we'll keep going and keep doing CPR until he